Healthcare worker infected with Ebola is being treated at an Atlanta hospital. Amber Vincent arrived in the city less than an hour ago and was immediately taken to a special isolation unit. She was diagnosed with Ebola in Dallas this week. The nurse was on the medical team that treated the late Thomas Duncan, the first Ebola diagnosis in the U.S. And as CCTV's Jim Spellman reports, this second case is raising serious concerns about how this crisis is being managed.
Amber Vincent is the second healthcare worker to contract Ebola in the United States. Like nurse Nina Pham, the first healthcare worker to contract the virus, Vincent treated Liberian Thomas Duncan in a Texas hospital before he died there last week. She began showing symptoms Tuesday, and officials say she was isolated within 90 minutes. Decontamination of her home began overnight.
Two things happened. One, that effective cleaning was done as soon as possible, and two, neighbors and the citizens were communicated.
Authorities are monitoring 3 people Vincent came into contact with once she developed symptoms. But the day before she went into isolation, Vincent had a low-grade fever and flew on this airplane from the U.S. state of Ohio back to Dallas, Texas. The plane has been isolated on a remote runway for decontamination, and officials at the U.S. Centers for Disease Control, the CDC, are tracking down all passengers on that flight for monitoring. Vincent is being transferred to this biocontainment unit at Emory University Hospital in Atlanta, Georgia, for treatment after serious doubts have been raised about how the hospital in Texas has been handling Ebola cases. Officials still don't know exactly how Pham and Vincent contracted Ebola.
We're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now, but we're looking at every possible angle around this.
According to a union that represents nurses, the first Ebola patient, Thomas Duncan, was left in open areas of the hospital for hours. Staff wasn't given proper protective gear or training, and hazardous waste was allowed to pile to the ceiling. Bottom line, the union says, healthcare workers are being put at unnecessary risk.
To the public, to the CDC, whatever, they say, we are all prepared, don't worry. And the nurses are saying, no, we are not.
And the CDC has confirmed that some of these healthcare workers even treated Duncan with some of their skin exposed. That's a clear violation of infection control protocols for a disease as dangerous as Ebola. Jim Spellman, CCTV, Washington.